Thanks, Daniel. With the opioid epidemic use at higher levels than normal, many people are saying prescriptions need to be watched closely. But some patients with chronic pain say that could make their already difficult lives truly miserable. There is a county-by-county prescription drug monitoring program in Missouri, but these patients say it may cause them unintended harm. One of them talked to KOMU8's Emma Claybrook.
The CDC warns that prescription opioids are addictive, and once people run out of them, they might turn to illegal drugs like heroin and fentanyl. The Prescription Drug Monitoring Program, or PDMP, in Missouri works by flagging patients who may be doctor shopping to get more medication. This weeds out the opioid abusers, but sometimes it hurts chronic pain patients who need the medicine to live a comfortable life.
See my house, it's so decorated for Christmas. This would all go away. I would not be able to do this. I wouldn't be able to do anything.
Deb Toshik suffers from rheumatoid arthritis and fibromyalgia. She takes oxycodone to help manage her pain, and she's been on the same dose for 7 years.
I don't know if you've ever been in that kind of pain, but it's relentless, and it's every day, all day long. It never goes away.
Let's pretend these candies are the prescription opioids Toshik takes every day. She takes 6 every day. That's 42 a week. 168 a month. That's more than 2,000 pills a year. She spends most of her days at home with her dog Athena and her network of chronic pain advocacy groups on Twitter. Greitens' executive order hasn't directly affected Toshik, but she is an advocate for chronic pain patients who have gotten their medications taken away.
So it's not a bad thing the way it's intended to work. However, sometimes it doesn't work out for good people that, haven't done anything wrong.
State Representative Mike Moon says if the executive order carved out the chronic pain patients, it would work just fine.
But once those orders start branching out and affecting the lives of citizens, as the executive order PDMP does, then that's they're overstepping their authority.
Greitens signed the executive order in July of 2017. It states Missouri is facing a, quote, public health crisis of epidemic proportions, and it cites the, quote, overabundance of prescription opioids as the cause. Even though Missouri is the only state without a statewide database to flag prescription drug use, it isn't the most abusive.
Missouri is about 25, 27 or so, and that other 49 are all 50 states. So if we are the only holdout state, you'd think we'd be the most abusive, but we're not. And so we're doing something right, apparently.
Representative Moon says prescription drugs aren't the problem. It's with fentanyl and heroin.
We're just taking a shotgun approach here, and we're not looking at the problem. The problem is illegal drugs.
According to the CDC, more than 9,000 people died from overdosing on prescription opioids like oxycodone and hydrocodone in 2016. That's compared to more than 34,000 people who died from overdosing on drugs like heroin and fentanyl. The only problem with the study is it doesn't separate out the prescription fentanyl from the illegal fentanyl.
A lot of this fentanyl that's being introduced in the United States has no potency control, and it can take the equivalent of 2 grains of salt, you know how tiny those are, of the drug to kill someone. And so you don't know what you're getting.
Opioids are only one part of Toshik's pain management plan.
You're doing your exercise, you're eating right, and you're getting your rest, and you take your medication on time in the way it's intended to be taken, and you're stable, and you're living life. Then all of a sudden, they want to take a part of that away. And it just upsets the apple cart, and then downhill you go.
Her goal is to get the executive order rescinded so she can fill her prescriptions and manage her pain. Greitens said the executive order was in response to the, quote, modern plague of opioids. In a press release, he said, quote, there is no single program or law or executive order that can fix this crisis. This program is a step, and it's a big step. Emma Claybrook, KOMU 8 News.